I'm Dr. Barry Eppley, plastic surgeon of Indianapolis. I wanted to spend a few minutes with you talking about injectable fillers. And the purpose of this information is that as we sit here today in 2008, there are 9 commercially available injectable fillers that are FDA approved here in the United States. That makes it tremendously confusing for patients to try to figure out which one of those fillers is best for them, if in fact one of them is really best. And so I'd like to go over some concepts about these injectable fillers to give you something to think about as you may contemplate treatments or to consider what you may have on your next injection session. Injectable fillers here in the United States have been around since 1981 with collagen, known as zyderm and Zyplast, and from 1981 to 2002, over a period of 21 years, this was the only injectable filler that was available. A patient had to be skin tested because the collagen was from cows to make sure they were not allergic, and the injections usually lasted around 6 weeks or so before they almost completely wore off. Beginning in 2002, a new era of injectable filler materials came out known as hyaluronic acid fillers, or hyalurons, which are really derived from sugar molecules. Since 2002, there have been 5 other hyaluronic acid-based fillers that has come out, as well as 2 particulated or beaded fillers, as well as another collagen-based filler. So you can see why this certainly causes a lot of confusion. When it comes to the hyaluron fillers, of which there are a variety, restylane, juvaderm, Prevail, eveless as the most recent one, all of these are really based on the same chemistry, and it really comes down to how long do they last when you try to compare them. Other than that, they are very similar. And in general, what you will find, although it's not absolutely always true, is that the more any of the specific hyaluronic filler costs, the longer it is going to last. Some of these hyaluronic fillers last 3 or 4 months. Other ones last as long as 6, 7, or 8 months. So you just have to be sure when you're talking about the hyaluronic fillers as to how long does it last and what am I paying for that duration of effect. Then we have the particulated fillers, otherwise known as radiesse and artefill. Radiesse is beads that are really ceramic in nature. Artefill is beads that are plastic. Both of these, because of the bead effect, are going to last longer than any of the hyalurons, and sometimes as much as 2 or 3 times as longer. The fundamental difference, besides some other chemistries between radiesse and artefill, is that the beads in radiesse do eventually go away, versus the beads in artefill are permanent. And that is why artefill advertises itself as the first to last, or the one that will last the longest. Now, do not be under the misconception, as many patients are, that if you are treated by artefill with one treatment, you are going to have a permanent, long-term, forever result. That simply is not true. It is possible over time that the beads may build up layers because they are not dissolvable, and you may have a long-term effect by that approach. But no single treatment of artefill or any injectable filler is ever going to be permanent. And then one of the newer collagens, and of course we haven't had a collagen since zyderm and Zyplast from the 80s, that's known as evolence. That's a collagen that is based from pigs, but it is not one which requires a skin test, and its duration of action seems to be somewhat similar to most of the hyaluronic acid fillers. So there's certainly some confusion around all these, but if you break it down into what is the filler made of, how long does it last, and what am I paying for how long it lasts, that should help you think about which one is really best for you. I'm Dr. Barry Eppley, plastic surgeon of Indianapolis, and I wish you the best on your plastic surgery search with injectable fillers.